Why are advanced coagulation tests used for stroke diagnosis? Imagine trying to solve a puzzle where some pieces are missing. That's often what doctors face when diagnosing stroke. They need to understand not just where the problem is but also what caused it. Advanced coagulation tests are like special tools that help fill in those missing pieces by giving a detailed picture of how blood clots form and break down. These tests are used because blood clotting issues can play a big role in strokes, especially in certain patients. There are two main types of strokes. Ischemic strokes happen when a blood clot blocks blood flow to the brain. Hemorrhagic strokes occur when a blood vessel in the brain bursts and causes bleeding. Since blood clots are involved in ischemic strokes, checking how well blood clots is essential for figuring out what caused the stroke and how to treat it safely. Basic blood tests like prothrombin time, activated partial thromboplastin time, and platelet counts are usually done first. They tell us if the blood clots too slowly or too quickly and if platelet levels are normal. But sometimes, these tests aren't enough to find the root cause. That's where advanced coagulation tests come in. These tests look deeper into the blood's clotting system. They check for specific clotting factors, inhibitors, or markers that indicate if someone has a clotting disorder. For example, they can detect inherited conditions like factor V-Leiden mutation or acquired issues like antiphospholipid antibodies. They also measure proteins like protein C and protein S, or levels of antithrombin triple. Another important marker is D-dimer, which shows if there is ongoing clot breakdown in the body. These tests are especially helpful in younger patients or those without typical risk factors for stroke, as they might have a hidden clotting problem that needs to be addressed. Using these advanced tests helps doctors identify if a person's blood is more likely to from dangerous clots. This information is crucial for understanding the cause of the stroke. If a clotting disorder is found, it can influence how the patient is treated afterward. For example, knowing about a hypercoagulable state might mean starting or adjusting blood-thinning medications to prevent future strokes. It also helps ensure that treatments like clot-busting drugs are used safely, as these can increase bleeding risk if the blood's clotting ability is abnormal. While imaging scans like CORT or MRI are essential for confirming the stroke's location and type, they don't tell us what caused it. Advanced coagulation tests complement imaging by revealing systemic blood clotting, issues that imaging cannot see. They are usually ordered after the patient is stabilized and initial tests are done, helping to build a complete picture of the patient's health. In summary, advanced coagulation tests are used in stroke diagnosis because they help detect blood clotting problems that might have caused or contributed to the stroke. They guide treatment choices, improve safety, and help prevent future strokes. These tests are part of a comprehensive approach that combines clinical assessment, blood tests, and imaging to give patients the best care possible. Always remember, each person's situation is unique, so it's important to consult healthcare professionals for personalized advice.